Well, we're on the home stretch here, and we've decided to begin by just giving, each of us will give 3 thoughts to summarize how we perceive things went, and then we want your feedback as to how the day went. And for me, first of all, well, hopefully I'm always honest, but I want to say that Regina really put a lot of the thought into what you've seen today. And so in some respects, I was somewhat walking around glazed because it was deja vu. I mean, because she really put it out, who the players were, what to expect. So I had to read the material, but I had a big picture. Rachel added the discipline in how it was structured. So it's a unique venue to be in when you've had this much prep. I don't think I've ever been to a meeting where I knew as much about the big picture, so that I was pretty receptive. But I would describe it on 3 levels. One was the complete, and I don't use that word lightly, complete thought process of the field from Dr. Ike. I mean, I don't think there was anything that that was left out. I mean, he had digested for us and reviewed so very much material. It was just a cornucopia of just thoughts that go into this process. So I found that overwhelmingly positive. The second was, with that, I then began to appreciate constraint, the appropriate constraint, reflex constraint, when to use the legal, what legal could do, what ethics could do, and that aspect for me was incredibly important, because while you think about it, what can't you do? I can run, but maybe I shouldn't run in the street, okay? And the third was application. Application for me, I mean, how do you really take this? What do you see it as doing? The distillate of everything that was discussed today. Is there a tool? Is there something available that I can see in the future that will allow me to process the information, and maybe at some point in the future when somebody's doing this, say, well, listen, just do this, this, and this. And that's where my friends from Boston University presented something that I could see this all being rolled into with more work. But again, so I saw the head, I saw the actual, the somatic part of it, and then I saw the application thereof. So for me, I would call this complete in overall structure. Yes, a ton of additional work, and also you got to sit next to Dr. Garant, who will always summarize everything that goes on in one word. Okay, so there's something will be going on, and and I said, yeah, that makes sense. So for me, it was this afternoon was this day was in no way wanting. So it, for me, I would say, was a complete, and as I alluded to earlier, a very rich day in material, structure, information, and direction.
So you know how we all have these cell phones and they do sometimes things that, whether you want them to or not. Well, mine has developed a new habit. It didn't exist before, it exists now, that when something comes up, it dings. I don't know, is it WhatsApp, is it text, I don't know. But so I had some dings, some things that just resonated so clearly because I went, wow, I hadn't thought about it that way. Okay, so I'm going to give you very pedestrian what I learned and what they really were the dings. And I'm sorry, but they're 4, not 3. The first was, and I've started these things, I've had the opportunity to do my own public-private partnership, and governance was like, okay, I need to have a board, I need to have something, right? Or maybe there's a couple structures. And it got more sophisticated over time, but this concept of spending the time and getting it right to begin with, have people take a deep breath and say, this really matters. And perhaps we can do a better job of helping lay out what questions your governance structure needs to answer. I think that could be really helpful for the new groups that are starting. Number two was something Mark Dybel said. And I was on his board for, well, not his board at that time, but on the board of the Global Fund. And I'm on something else right now, which is a very different organization. And the second was that structure matters. He said, the Global Fund, the board is a parliament. Wow, that turned, now I understand. I mean, I knew it was very political, but understanding the structure and the implications of that structure. The other one I'm dealing with right now is counsel for ASTMH, and the rules that govern how decisions are made and who needs to approve and how it works are different than for an NGO or they're different for governments. So structure matters, and you better figure out what structure you have. Number three is, I think, is probably worth us, the forum, discussing further, because we've struggled with this concept of conflict of interest. And I know that it's almost visceral for some groups because they've been hurt by it. It's something where they feel in some situations they're not credible. And what I heard from very senior people is that, yeah, we're all conflicted in one way or another. And we have ways of managing, and we do it, and yeah, get over it. So I don't know if in that context that is something that we can quote unquote get over, or we need better tools to do so. But clearly there are people who feel like for a number of situations that it's okay. Yes, there are conflicts of interest. Yes, there are ways of managing that. And I really think it's to bring it back to the forum and say, do we understand the full panoply of what those are? And then the fourth was something that went ding because I went, ooh, I hadn't thought about that. So I always like that. And that was quote unquote, the ethical dimension of governance. And that sounds really cool. I have no idea what it means. We started exploring that in our little afternoon breakout group on what it could mean. It sounds really important, and I think I need to flesh that out in my mind, and perhaps we can tackle some of that tomorrow. Ethical dimension of governance. I think we were talking about how decisions are made at the country level, and we've got groups that are advocating for my intervention versus your intervention, and the poor Minister of Health and President are trying to divide the research. I think that's an element of it, but I think that's something that really should be, it's like hanging Chad. I haven't solved that one. I don't know what it means, so I don't know what the solution set is. So that's what I learned. There's really so much more, and I've been to a number, I've dealt with governance, I've been to a number of discussions or places where we discuss it, and this was as comprehensive but as challenging. I think all of the issues came out, and it'll be up to the home team to turn this into a very thoughtful document that I think can be an advance for the field. But I think many of you will have had your little dings that went off because there was things you hadn't thought about. And what we thought is that we would ask the organizing committee, first of all, for your thoughts, because you've been thinking along with us as part of this. You generated and drove different sessions, and ask you to make your comments on what you thought of. So who would like to start? Organizing committee, who's left? Yes, please, microphone. Yeah, I was going to run around with this. I realized you all have microphones. This is a wonderful place to be.
Yeah, one of the first things I learned this morning is that push to talk apparently needs arrows on it. When we set this up, one of the first conversations that we had is when you think about governance, and remember, we're coming off of May where it was all about technology. So we had a lot of cool, neat, new stuff, and that was a pretty exciting workshop. So we ran the risk of governance could be pretty dry. And so our challenge really from the very beginning, from the first meeting, was how do we make it not dry? How do we keep it interesting? How do we keep it relevant? How do we keep it exciting? And how do we keep you and us engaged? And I think we did that. I think we did that really well. There was such, as Clarion said, there was such a rich variety and diversity of speakers and participants that if you didn't, I would go so far as to challenge and say if you didn't get a couple dings, then you may not have been paying full attention because again, all the different perspectives, and it really came out. So as much as anything, we took what ran the risk of being quite a dry topic, and we at least turned it into some thought-provoking exercises. So, Kate, I'll turn it over to you.
Thank you. I think my ding was more of a slap in the face for just the number of times I've said when we've started partnerships, we really need to spend the time getting ourselves sorted before we start on the work. We really need to get our structure sorted. We really need to think about what our objectives are. We really need to agree what roles and responsibilities are. We need to agree what happens if it goes wrong. And, you know, hand on heart, I would say pretty much every partnership, we've said, yeah, and got on with it. And then had to worry later on when something maybe quite doesn't go the way that we want. So really slap to me kind of going, you've really got to get that sorted next time you get started on a partnership. The second thing, more of a, not really much of a ding, but as I am sort of fun employed at the moment, is working out how to get the US government lawyer to give me an hourly rate for giving her ideas and how she's going to do things going forward. So I was pretty proud of that, and I imagine her hourly rate's more than mine, so I'm looking forward to some compensation from the US government.
Good luck with that one. Other comments? Let me open it up. What were your dings? What did you learn? Please.
I had a few, actually. I have to say, I think one of the, couple just quick impressions, I think. One was the power of the pre-existing stereotypes each sector has of each other. And that was sort of tied to some really important observations about all parties really need to change. Everybody's conflicted. Nobody, this idea of stigmatizing the private sector and sort of saying that that's the problem that has to be fixed. And I think it was so apparent that, and I thought that was really helpful to sort of blow that up a bit. It's that sort of, somebody said urban myth later, but being an urban purpose, I don't like to use that term that much. But anyway, I think that was important. And then a second observation was just this use of language may keep us stuck. I mean, it has advantages in terms of people knowing sort of generally what you're talking about, but if you're going to go below the first level conversation, you really have to define your terms. And I was struck by, having come out of a school of public policy, that there is a literature in the public administration literature that's a much clearer than the literature coming out of public health and even business. I think in some ways it would be interesting to throw that into the soup for the rest of our other kinds of conversations. And then the last thing that was the most, to some degree, depressing but also interesting, I think, was the incredible complexity of the conversation about something that really is probably one of the most arguably straightforward partnerships, which is product distribution. It isn't even product development, it's product distribution in a partnership that doesn't involve, all the things it doesn't involve. And hearing this kind of really rich, complex conversation, it just made me worry about partnerships that are more complex. Even product development we flirted with a little bit. Some of the areas we've been trying to get into is stuff outside of the personal healthcare delivery system, which is really complicated. And then we didn't talk a lot about intellectual property and academia's constraints and other things. So I think it was the chastening part was that. The really encouraging part was some people, and I think maybe it was you, Regina, that said, what is the next generation of these things? How could we move through, by virtue of the nature of this group and it being together for a while, really move through those obstacles in a way and sort of begin to chart a new course and a new set of opportunities. So that was really encouraging. It was a very rich day. So.
Thank you, very thoughtful. Anyone else would like to make a comment, please?
Hi, I'm Lucy O'Donoghue from the CDC. I was really struck with Steve from Path talking about coming as the farm boy, and I certainly felt like that too. Most of my time has been much more on the ground in local communities and being that one who's trying to report back to the donor. And I realized listening in the room today that it's not that we sort of forget that you don't necessarily have the exposure to this environment where we're dealing with all these constraints, and you're not averse to you want to understand, you want to know what those constraints are. And I had this interesting conversation with Leslie Ann about that if we're talking about reporting back and providing, accurate information about the impact of these programs, we first of all need to know that we need to tell you guys what it takes to do that and how difficult that can be on a very practical level. So, but it was encouraging to hear that there's that desire for that really, really accurate information. And just that the learning of the cultures and the learning of the capacities of the different kinds of actors. If you understand what it takes for us right on the ground with someone who can barely use Excel to gather certain data that you're going to need to prove your impact at the end of the line, then, we can start to understand what it takes to work together when there's those different capacities. So, yeah, really great. That was great.
Thank you. Thank you for that. Others?
Regina, since I'm at this table, I'd like to echo what I just heard on the different languages and shall we say vantage points. I think one of the biggest challenges still, and I've been in the different sectors, so I'm one of the quad athletes, whatever said earlier. I've been in private sector, NGO, government, now private sector, and in thinking about that, the timing is one of the biggest issues. Of how long it takes, and as Joe was suggesting, the language that you need to use to understand not just KPIs and not just ROIs. And seeing a lot of these today, and we have the health outcomes as the indicator, but we didn't do a lot of ROI. We didn't have a lot of the health economists to say, why are we investing in this partnership rather than some technological innovation? Why are we
That's
investing?
the ethical component.
Right. So I think
And
that the
ROI
technical
also.
and ethical and the timing element, while it's still, we had so much today, there's only so much you can do in a given day, it still troubles me that it's so difficult to do some of these, and it's so easy to exclude key players that we will miss the opportunity. So my challenge at the end is I'm trying to come up with a better word than a PPP and multi-sectoral, and it's a challenge to everyone. It has meaning to people that they're part of the players and they've got skin in the game and all those other metaphors that we all want to work together to do some good work in global health. So, I want to thank and congratulate the organizers again. I thought this was a really rich day, and hopefully, everybody got something out of it.
Well, we're 5 minutes post time. I really want to thank, first of all, everyone that stuck it out to the end. And as a reward, we have refreshments outside, but really want to thank you for your engagement, because that's really what it took to make this, I think, work, and I think it worked quite well. So thank you very much.